So here we are, May 19. Yep, that is correct. 2020. Today we have 657 cases in Ingham County, 23 deaths, 3 hospitalized, 1 of those in the ICU. 361 of our current 657 are home, and another 270 recovered, excuse me. And then of course our active and completed monitoring numbers are there. Monitoring continues as well. So that basically has us with almost all of our people at home rather than the hospital. You know, 3 out of 600 and something is less than 1%. And of course that 1 person in ICU as well. Whoops. And this is what our hospitalization looks like in Ingham County. We've been, you know, really just down here in this about 3 people range for quite a while now, with the exception of the 13th there. So, and this is our status really of kind of the totality of our current cases, 54.9% at home, a hospitalization rate of about 0.3 with ICU at 0.2, our mortality rate at about 3.5% right now with 41.1% recovered. And then this is our daily cumulative graph. We're looking for that to flatten. Eventually we'll just see a nice flat curve, or less than a curve going there as it flattens out, and we continue to have cases but not very many on any given day, so that should turn relatively flat. I'm gonna, this is our incidence curve. This is our Ingham County incidence curve, so daily cases. So you see that we kind of almost had a bit of a curve here that came back down and another one here that came back down. We're just plateauing in this area. If you look at our percent positives per day, that number has also trended down. And if you look at those two together with a 7-day rolling average on both our daily incidents as well as our percent positives per day, we did, as we showed you last week, have a little bit of an uptick in percent positives for a few days here, which is trending back down again right now. I think, yeah. So these are our zip codes. We still have 48911 in the 191 to 201 category. And then after that, 48910, 48823, which is East Lansing, 48854, 64, and 4908906 as we continue going down. We still have, 8 zip codes that have less than 10 cases. So if we look at those on a map by case, this is the shading where the dark blue is our 48911, and then our other zip code that was next was 48910, and then East Lansing 48823 after that. Then a couple zip codes fall into these other ranges. Looking at that by rate or per 100,000 people, we dropped out all of the zip codes, that have less than 20 cases to calculate accurate rates. And so this is what a rate map looks like. So clearly the rate in 48911, yes, along with the actual number of cases, places it in a higher range or a darker category than the others. And for some reason my screen is frozen. There we go. So new to you this week is a heat map. So this is a heat map of our cases, a little bit of a zoomed in thing. If you look countywide, you get a lot of dots all over the place. But certainly we've been looking at particular zip codes. The lines you see here is 48911 all through here. So all of this yellow within this area are part of that 48911. It actually goes down here right under I-96, which is right here. So this is that zip code line right in here. So this is our 48911 zip code on a heat map. And then our cases by sex are still basically 50% male, 50% female. Cases by age are basically distributed this way. Our highest group is our 20 to 29, followed by our 30 to 39 and 50 to 59, and then our 40 to 49 age groups. If you look at that in 48911, you see basically that, again, the younger age group to some extent. One of the things that I did was take 48911 and look at it by race. So when we look at age groups by race in 48911, we do see a little bit of a different way that these trend out. In our Asian population, it's certainly, I mean, when you look at these numbers here compared to these here, it's definitely a younger demographic compared to in our Black population. This is where our predominant, cases are in the 50 to 59 age range, so a little bit different. And then in the white population as well, a little bit more of a I would say a peak in the middle age range. If we look at our cases by race across the county in percent, they're 46% Caucasian, 26% African American or Black, 16% Asian, 3% other. If we look at that same statistic, again, I apologize. I thought I'd gotten all these labels correctly here. But if we look at that differently, or by 48911, we see that we have about 44% in our 48911 zip code that are Asian, about 27% African American, a very small percent Caucasian or other in comparison. The prevalence rate, again, now we calculate per 100,000 population and bring everything to that number. We see that our Caucasians are at 142, with African Americans or Black at 524, and Asians at 576. So those two certainly are by far our most prevalent race groups, and are about four times what it is with our Caucasian population. If we look at that prevalence rate in 48911, we see that our Asian population has a rate of 3,888 compared to our Black or African Americans at 495, Caucasians at 174, and other at 237. If we look by ethnicity countywide, we have about 9.8% of our cases that are Hispanic or Latino, and the rest are either unknown or non-Hispanic or Latino. And if we look at that in 48911, 85.1% are non-Hispanic, 4.6% Hispanic or Latino, and 10.3% unknown. If we look at that also by rate, not Hispanic or Latino at a 193.9 rate, our Hispanics or Latinos at 281.8. We're still trying to fill in some of the blanks with the unknowns so that we get a clearer picture of what that disparity actually is. If you look at that in 48911, then basically our Latino population, the rate there is about 39 compared to our non-Hispanic or Latinos at 62. One of the other things that I've done is look at some of the outbreaks that we have in the county. So 207 or 32% of our Ingham County cases, this was yesterday that I put this together, so I have a different case number, are associated with an outbreak. Those outbreaks are broken down like this in terms of the percent that they reflect of the 207 cases. So almost 9% of those are at Meyer Warehouse. The Herbooks outbreak is about 6.6%. The MDOC, we have MDOC employees that have been testing positive that reside in our county. That's about 4.5%. We have a sundry others that I just brought together at 2.3%. Your Bircham Hills outbreak at 2.3%, 1.1% at Peckham, 4.2% at Ingham County Medical Facility, and then the 0.9% at KTM. If you look at those outbreaks associated in cases in 48911, about 28.7% of the cases associated with an outbreak are in the Meyer Warehouse. 37.9% are associated with or excuse me, 23.6% are associated with Herbrooks, 2.1% are with KTM, 3.6% Victor Springs, 3.4% MDOC, no, yes. And then basically the 37.9% are the non-outbreak associated. So that's community transmission. So this is percent overall, whereas the other one was a percent of cases associated with an outbreak. If we look at our deaths in the county by age, 8.3% in the 50 to 59 age group, 20.8% in the 60 to 69 age group, 29.2% in the 70 to 79 age group, and 41.7% of our deaths over 80. We are 58.3% of our deaths male, 41.7% female. And then if you look at that by race, 63% are Caucasian, 33% African American, and 4% other. Also by ethnicity, 83% of our deaths are non-Hispanic or Latino, 8% are Hispanic or Latino, 8% unknown. I'm going to talk a little bit about, and I moved some of my data to this part about it because we're talking gating now and we're talking reopening. And businesses and ports and people all over the place are talking about what are the criteria that we need to have in place to reopen. You see that the governor just reopened some additional things in Region 6, which is the northern Upper Peninsula, as well as Region 8, which is the Upper Peninsula. And that was based on gating criteria that they have established, where we either have a downward trajectory in overall surveillance of influenza-like symptoms, we have a downward trajectory of cases, or a downward trajectory of positives as a percent of total tests in a 14-day period, and we know that our hospitals can treat patients without crisis care, and we also have robust testing in place for a number of different situations. So that's where I've been looking at this more regional graph for you to show you that basically our daily incidence and our percent positive. This is relative to basically helping the region and people within the region determine these gating criteria. Now this is just Clinton, Eaton, and Ingham counties. The region would also add in Gratiot and Shiawassee counties, and they are not in this graph. If we look at our hospital capacity, again, I think I showed you last week what Region 1 was. It's a slew of counties from Lenawee to Jackson to Eaton and Clinton, and there's a number of counties in there. Don't get it mistaken with the Merck region that we are in, which is the 5 counties that I just mentioned. So this is our hospital capacity across our preparedness region. For some reason, it didn't throw labels on the last set of graphs, but there you go. So 1,512 beds across the region, 880 occupied. If we look at our Clinton, Eaton, Ingham area, we've got 877 beds with 563 occupied. The vast majority of those beds are in Ingham County in terms of those numbers. If we look at ICU capacity across the region, 204 ICU beds. That does include the pediatric NICU beds. Somebody asked that last week. And 121 occupied. In the capital region, 76 total with 38 occupied. 74 of those are in Ingham County with 37 occupied. We've talked a little bit about this whole idea of, an article that I read a while ago called Coronavirus, the Hammer and the Dance. And the reason I bring this out now is to talk about exactly what that dance is. And that is, as we enter this stage where hopefully we're in this low level of transmission ongoing, we're looking at keeping our R0 or an R value below 1. We're looking at having this proper testing, education, banning gatherings, restrictions, some restrictions removed, tightening up when needed, and those sorts of things. And so the gating criteria allows us to move into that stage. That kind of says we're kind of in perhaps that dance stage now. And those are the things we need to do to maintain ourselves in that. And so as we go out into the workplace, we need to be thinking about the ways that we can continue to create that sense of containment. Because it's not just about being out and about and socially distancing. Now it's about people in the workplace and other places, about businesses opening, about restaurants opening, those sorts of things. And how do we go about keeping protections in place that will help us to keep infections or ongoing transmission under control. You know, we remove the hazard, we replace the hazard, we isolate people from it, we change the way people work. Lots of administrative controls around signage and spacing, markings on the floor to keep people 6 feet away, seating people every other table, blocking off certain chairs, all of those administrative controls, and then personal protective equipment. When the governor put out the information about the Michigan Economic Recovery regions, she basically put this up and talked about across the 9 different workplace types, the best mitigation strategies fall into, again, these buckets and kind of align with that hierarchy of controls. We're talking about access control, in other words, symptoms, monitoring, symptom diaries, on-site temperature checks, the ability to rapidly diagnose and isolate and quarantine, intake procedures for visitors, guidelines for delivery areas. Then we look at social distancing, remote work standards, teleworking, restrictions on common areas, restrictions on in-person meeting sizes, workplaces, restrictions on travel and non-essential external meetings. And then the various sanitation and hygiene things from disinfection to availability of hand washing, HEPA filters, exhaust systems, restrictions on sharing, tooling, and machinery. Again, we go into personal protective equipment, which goes, you know, from masks to gowns to shields, and is, you know, definitely different types of personal protective equipment is going to be necessary in different environments. When you start talking about gowns and face shields and that sort of thing, that is typically a first responder and healthcare type of environment. And then we talk about contact tracing, our ability to investigate, isolate, quarantine, notify, and then in the event of somebody being identified in a place, also the ability to shut down the facility or parts of the facility and ensure that there's adequate cleaning practices that go in place that allow that to open. So I just thought I would share with you a little bit of that information now that we're doing a lot of talk about reopening and have reopened 2 regions, and show you some of the information in terms of data that goes into assessing that in terms of the use gating criteria, as well as even here within the county with the relaunch Greater Lansing that is going on, as well as our own court systems, et cetera. You know, they are working with us on this data in order to help them understand and work with the gating criteria so that they know where we're headed in terms of reopening. So I will open to questions.
I do not have any questions in the queue right now. I have been having some connectivity issues, so if I drop off the call, I will come back. Megan, go ahead.
So talking about reopening, with PPE being a critical part of it, are there local strategies for making sure that there's enough PPE both for restaurants that are reopening, but to make sure that like healthcare facilities still have access to what they need?
Yeah, so there are a lot of efforts going on, everything from the strategic national stockpile to local efforts to, you know, lots of sourcing sorts of things, even within our smaller business community, chamber of commerce, et cetera, around PPE for hospitals. When we go out into the broader group, you know, that is also, I mean, fortunately we have a very robust group with our regional chamber of commerce that's helping a lot with that. In terms of sourcing PPE that's going to be needed in more like businesses. That, and they also, actually just before the pandemic hit, they actually had brought together a group of business tech people, kind of science people, like, it's not Biogen anymore, or is it? Neogen. Is that the name of it? Anyway, companies in town that are involved in biotech industry that kind of have come together and are looking at the ways that they can create and innovate and repurpose sometimes, you know, what they do and work together and things. So that group of people came together and started figuring out how to make shields, how to make sanitizer, how to source gowns, how to source masks, those sorts of things. So there is kind of a subgroup within the Chamber of Commerce that started up before all of this and is not necessarily tied to relaunch, that is also looking at, as a region, we have a lot of tech companies, and a lot of those tech companies have the ability to basically meet those needs at this point in time. And so the Chamber is helping bring those entities together to then meet needs more broadly within the community.
Rachel Sweet, go ahead.
Hello. So you talked about reopening, how Traverse City is reopening. How do you think Ingham County compares to the UP or Traverse City region in terms of being able to reopen?
We're a little behind where they are. I mean, if you look at what's been going on in the northern UP and, in the UP and the northern lower peninsula, they really had relatively few cases. And so it's, it was fairly easy for them to get to a point where reopening seemed like a logical thing to do. Other parts of the state, not so much. I think that if you look at Ingham County, in some ways, I think we're poised to be a little bit in a sweet spot, maybe, to be next. I don't know. So the reason I say that is clearly you've got the northern lower peninsula and the upper peninsula that saw much less significant impact than we did. We saw the Detroit area that was impacted heavily, and even if their case counts are going down, they still have a lot of cases. But we kind of started having cases around the same time they did. So we were kind of reaching our peak and then coming back down about the same time, but with lower cases. Whereas if you look on the west side of the state, they started getting cases and started peaking later. And so I think we're ahead of them. We're definitely behind some others. And I also think that there's the possibility that there are some, and I don't know which region it is, but it's kind of more over towards the thumb, that they also have some issues there that might keep them from reaching those gating criteria sooner. So, it's one of those guess things, but I think we're poised to be soon, if not next. When that next is, I don't know.
Well, I like to hear we're the sweet spot.
It kind of looks like we could be, so.
Thank you.
I always reserve the right to have to backtrack on anything that I say based on the fact that new information comes out every day. But right now we're trending fairly well, and you can see that that's where we're heading. So I think Amanda left, so Megan, I see your hand raised. I apparently became the host.
So we're starting to see hospitals do not necessarily elective surgeries, but more essential surgeries, and starting to allow visitors. When do you think that nursing homes can start getting back onto that track? Because obviously, their residents are at higher risk.
On track with what? Visitors?
Allowing visitors and such.
Okay. You know what? One of the things that you see in the whole idea of social isolation, or social distancing, and staying isolated or quarantined is that there's a reason to say that some people who are more vulnerable are probably going to have to stay in that mode for longer. Even if, as we look at bringing our own employees back into work, one of the things I want to know is what vulnerabilities might these employees have? What health conditions might they have? How old are they? My employees that are over 65, and those are people that it's like, no, we should keep them home for a little longer. The same thing goes with nursing homes, long-term care facilities, in that, there's such high risk there, and it doesn't take much for it to spread very rapidly because there's so many vulnerable people congregated in one place. And we are working so hard and have worked so hard to keep our long-term care facility outbreaks at a minimum. And I think we've done a good job of that. If you start introducing the outside into that, I think we're asking for trouble right away. I think it's going to be a lot. I think reasonably and rightfully so, it's going to be a lot. And And that really, I mean, that's very sad. I mean, I can't imagine. I can't imagine having my dad, who passed away almost a year ago, in some sort of a long-term care facility nearby. I mean, he wasn't nearby, but nearby, and not being able to see him. You know, clearly we have Zoom, we have FaceTime, things like that. That's how I see my grandchildren. I guess that's how I see my father. But it's tough, and I think it's even tougher when, you know, those people die, and they might be dying alone. I think the nursing homes and the hospitals have done a fairly good job of being able to bring in some immediate family members, gowned up, gloved up, masked up, all of that sort of stuff, so that they could be with their loved ones as it became, the period of time when they knew that they were going to die. Because a lot of them are going, shifting over to comfort or palliative care shortly before they pass away. So I think we're going to have to hold tight on that for a while, and I can't tell you how long.
Rachel Sweet?
One more question. Now that up north has been opened up, and this weekend being Memorial Day weekend, a lot of people might be going up to travel to their cottage. Is there any worry for our county once the weekend is over, when people come back, traveling back and forth, do you think?
Well, first, the ability to travel back and forth to your cottage up north was opened a little bit ago. They changed that one, the same time we opened golf courses, I think, when we reopened the golf courses a couple weeks ago or a week ago. So I think it's the reopening of all the businesses, the restaurants with limited, mostly outdoor dining, but limited indoor dining. There's always a risk. Clearly, starting to let people move around again brings along with it risks. However, eventually we have to get there. We have to start moving around. We have to see that numbers are at a certain place and that we can manage that. And we have to have, hopefully, some faith in people to continue to do all of the things that they should be doing in order to prevent us from having problems that we're kind of moving around the state. So is there some risk? Yes. Is the risk fairly minimal? Yes. So it's just something for us to keep an eye on, and there's those kinds of things that say, okay, it's time to shut that down again, which hopefully we don't get to.
Thank you.
Does anyone have any questions for Health Officer Vail?
I'm just going to let you know that Friday I have asked Dr. Sharienka to come on. She is our medical director. The question last week about some of the symptoms that were going on with children, the inflammatory diseases, the Kawasaki thing, stuff like that. She's going to come on and talk a little bit about some of the various medical presentations and issues that we have been seeing with this, from the clots to the strange presentation of illnesses in children to a variety of things. So she will be with us on Friday to talk about kind of the context and the kind of the breadth of what we're seeing from a medical perspective.